We did general auscultation. We auscultated the liver and the spleen for rubs. And then we auscultated for bruits. We had 7 listening spots: aorta, bilateral renals, bilateral iliacs, bilateral femorals. Right? Good. After we auscultated, we percussed. We did general percussion. We percussed liver, right? We percussed spleen, and then we did Murphy's kidney punch. That brings us to palpation, okay? Now, when we palpate, there's going to be several different tests we do. We're going to start with general palpation again. General palpation, you think I'm going to palpate in quadrants? Yeah, just like our general auscultation and percussion. So we'll palpate around in quadrants. What direction do you think I'm going to go? Clockwise or counterclockwise? Clockwise. What area do you think I'll do last?
Pain.
Area of pain. Does that make sense? So go ahead and sure. So here, when we do our general palpation, there's going to be light palpation and deep palpation. We perform light first, right? What do you think I'm going to feel for with light palpation? What's that? Could be swelling. What else? What's that? Yeah, she said muscle tension. I'm looking for rigidity, right? Now there may be pain, things like that too, but really, rigidity is one of those peritoneal signs, right? That would tell me I probably, if they're acute pain, rigidity, I don't want to go in with deep palpation, right? So we start off, is there guarding rigidity? So let's say the pain is here, right lower quadrant. Start right upper. One hand, you see how the pads of my fingers are flat, palpating in a circular motion, right? Kind of like we did with palpation of other parts of the body. For practical purposes, again, I want to see 2 areas in each quadrant, okay? But that is not a minimum or a maximum, really. In practice, you do what you need to get the right diagnosis. Now, how deep am I palpating here? Yeah, so what would you say? Yes. What does it look like to you?
Half an inch?
Yeah, so we want to go up to an inch. So we said half an inch, somewhere in there, up to an inch deep with our light palpation. Does that make sense? All right, then we'll go deep. Same thing, all the quadrants, clockwise, area of pain last. Deep palpation is 2 hands. The hand that's on bottom is the hand that palpates. The hand on top is what applies the pressure. So you can see if I remove my top hand, that's where the pressure's from. The bottom hand moves, right? Now here, we're going to go deeper. So how deep does it look like I'm going now? Yeah, so we want to go anywhere from 1 to 3 inches, okay? So you can go up to 3 inches if the patient tolerates. Does that make sense? And what do you think I'm palpating for at this point? So we're looking for pain, tenderness, and we're looking for any masses. Okay, does that make sense? So pain, tenderness, masses. Clockwise, all right? Simple? Now, the next thing we're going to palpate is the liver. Now, if I tell you I'm going to palpate his liver, am I going to feel the liver here? So where is the only place I might be able to palpate the liver? What's that?
Inferior side.
The inferior border. Where is the inferior? You just percussed it a minute ago. Where's the inferior border?
Just below.
The liver. Where was it? Kind of in this area, right? So in order to get to that inferior border and palpate it, I'm going to hook under the costal margins. We're going to use a hook technique, okay? Does that make sense? Now, the liver should palpate smooth, firm, with sharp margins, okay? So I'm going to tell the patient, I'm going to palpate your liver, you're going to feel me hook under the ribs, okay? So give him a little warning, and I just start to hook here. Now, if he tightens up, which he did, now he relaxed, I just go a little more, right? And I'll wait the patient out. I don't tell him what I'm doing. Yeah. Right? Now, if you have long fingernails, you're going to have to cut your fingernails for this, okay? Now, right here. Can you feel that? He can feel that I can feel his liver there. He can feel that I'm on it. And it's smooth, it's firm, right? Normal. Now, what I'm going to do is I come here and I palpate it. I'm on his liver already. But then I'm going to ask the patient to take a deep breath. That brings the liver down. And I palpate it, okay? He can relax. Even as he relaxes, I like to palpate it because the muscles relax some and it's easy to palpate on the way down. Does that make sense? So what do we call that technique for liver palpation? Hooking. How should the liver palpate? Smooth, firm, sharp. Now, if it's painful and kind of soft or mushy, that's usually a sign of infection. Hepatitis, for instance, right? Cancer, if there's a lesion on that border, like anywhere else, firm, irregular, not movable. And then cirrhosis, what's cirrhosis? Yeah, hardening. It means scarring, fibrosis of the liver, right? So that can, someone has chronic inflammation, say hepatitis B, hepatitis C, eventually, or lots of toxins, they abuse alcohol throughout their life. Eventually you get cell death and fibrosis. That's what cirrhosis is. So lots of things can cause it. Does that make sense? But if there's cirrhosis, it tends to be kind of hard and rounded, maybe even a little irregular. Does that make sense? Okay? So I want you to go ahead and palpate light and deep palpation, and then palpate the liver. Make sure you can feel it, okay?